What's up, y'all? It's your man G-Way, holding it down, G-Way Podcast, and we are still here at the Heritage Fund of Atlanta Medical Association. We're having an all-white party. They're having an all-white party, and we've been having the pleasure of sitting down with some amazing people. You know how we call them. We call them the stars and celebrities, a.k.a. the businessmen and women of Atlanta doing what they do. And I have the pleasure of sitting down with Eric Nixon from the Brighter Day Health Foundation. I'm going to have you hold that mic up to you. There we go. How you doing, sir?
I'm doing well, sir. How are you?
I'm doing well. Now, what is your association with the Heritage Fund on tonight?
Well, we're a gold sponsor, and Dr. Collier asked us to be a part, and we're building a national network of church-based wellness clinics.
That is awesome.
That specializes in chronic disease management as well as lifestyle medicine. And so we're very proud of the work that we're doing. We're primarily supporting minority and underserved populations. Mm-hmm. And we have two clinics currently, one at Word of Faith, Bishop Dale Bronner's
Bill
Church.
Bronner, absolutely.
And we also have a clinic at Impact Church in East Point.
Okay.
And so we're looking to scale to 10 clinics to have a broad geographic footprint across Atlanta. So we're just starting here in Atlanta. You know, no stopping us now. We'll be going to, other places all over the country. So we're just building a network to increase access to health care for African Americans.
Well, let me ask you this question. How important is having these clinics built amongst the religious community?
Right. Well, we found that, a lot of the pastors are visionaries, and they want to take care of their flock.
Yeah.
And so as a result, most of the pastors that we talk with, they're on board immediately because they see the value of preventive care. They see the value of taking care of those congregants that have diabetes, hypertension, obesity, heart disease. African Americans have the worst in terms of health outcomes amongst all races. We do the worst, but our job at Brighter Day Health Foundation is to provide greater access to clinical trained professionals to help change black healthcare.
Now, is it important for the Brighter Day Health Foundation to only work with the religious community, or are you working also outside of?
Well, the goal is to start in the faith-based community and then expand to the communities at large.
Okay.
So, for instance, at Impact Church, we are starting our what we call an external marketing program, which allows us to engage the community around the church. So we're calling those health equity zones.
Okay.
And so we want to then bring corporate dollars to those health equity zones to help change the healthcare in that particular area. So it's not just limited, but we just start in the churches because essentially the churches are deeply ingrained in the community, and a lot of things that keep us from seeing a physician. We don't have child care. We can't get off work. We don't have transportation.
Right.
So we're trying to address those things called non-clinical barriers to care. And by being in the church on the weekends, then we're trying to take all those barriers away.
Okay, so what are you guys doing to encourage the participation in the foundation,
Right.
with the foundation?
Well, we're endorsed by the pastors, which is a center of influence. They have a lot of influence over their members. And then we're using a lot of testimonials that we have gotten over the course of our since we've opened. And our outcomes, most 30 to 40% of our patients have lost over 20 to 30 pounds. And the most important part about that is obesity is a risk factor for 15 to 20 other diseases, including some cancers.
Yes.
So if we could just change our diet and lose weight, then we'll be more healthy as a community, as a people. So we're starting in the churches and we're expanding from there.
Gotcha. Now, what are plans to take it across the country?
Absolutely. Well, the goal here is we have corporate sponsors from Novartis as well as Blue Cross Blue Shield.
Okay.
And so as a result, we want to get more corporate sponsors, and then we want to invite many of the people here today to be collaborating physicians to help us on our mission to change black healthcare.
Okay. Well, Eric Nixon, where can people find out more about you, more about Brighter Day Health Foundation? Where do they go?
Sure. So they can go to our website, We have several, but the main one is at providentialmd.com.
Okay.
Or Brighter Day Health Foundation. No, brighterdayhealth.org. brighterdayhealth.org.
Do you guys have a social media?
We do, but it's under development,
Okay.
so we're expanding and making sure that we, cover that base. But I'd rather, if those were looking for us to connect, brighterdayhealth.org is probably the best place to go.
Okay, now last question. What are you looking forward to on tonight?
Tonight is to have a good time, to share the message of what we're doing, and make sure that the physicians here in Atlanta understand how to reach out to us and know our mission, and hopefully they would collaborate with us and join us in our quest to change black healthcare.
Awesome. Well, Eric Nixon, once again, I appreciate you sitting down with us.
Absolutely.
Y'all make sure y'all find out more about his organization, Brighter Day Health Foundation, and become a part of that. Become a part of this Heritage Fund. All of them things that you can participate in to help increase the numbers of African American doctors in our community. This is what we need.
Absolutely, bro.
Thank you so much.
Thank you.
It's your man G-Wade holding it down, G-Wade Podcast. Y'all know what it is. Don't go nowhere.